Hey there, and welcome to This Explainer. Today, we're diving into something that, let's be real, almost every single one of us is going to have to deal with at some point. Knee pain. Whether you've just felt a sudden, sharp twinge when walking the dog, a dull ache after a long day on your feet, or maybe you're watching a loved one struggle just to get up the stairs, knee pain is a very real, everyday challenge. But today, we're not just going to complain about the problem. We are going to completely unpack it. We're looking at the actual causes, the undeniable facts, and most importantly, the practical solutions you can start using right away.
So you might be wondering, is this all just because of getting older? I mean, look around. It literally feels like everyone is troubled by knee pain nowadays. Sure, you've got older adults struggling with their morning walks, but then you also see healthy 20-something athletes stretching out a strained knee on the sidelines, or even office workers grabbing their joints after just sitting at a desk for a few hours. It's a totally universal experience. So is it just an unavoidable part of aging? Or is there something a bit wonky with our modern lifestyle? That is exactly what we're going to figure out right now. Here is our game plan for today. We'll quickly define what knee pain actually is, dig into the main causes and symptoms, and lay out a really solid toolkit of both home and medical solutions. After that, we'll hit some simple ways to prevent it from happening in the first place, and finally, we'll separate the real facts from the common myths.
All right, Section 1. What exactly is knee pain?
When we say knee pain, we're actually talking about a whole mix of things. It could be pain, swelling, stiffness, or just not being able to move your joint the way you used to. Think of your knee as this incredibly complex machine. It relies heavily on cartilage, which acts like a built-in shock absorber, and ligaments, those tough little bands of tissue holding the whole shebang together. When either of those gets worn down or damaged, yep, you feel pain. Now, this pain can be acute, like a sudden temporary tweak from a weird step, or it can be chronic, meaning it's a long-term ongoing battle. Understanding this baseline is absolutely crucial, because fixing a temporary strain is way different from managing years of chronic wear and tear.
Moving into Section 2, the main causes and symptoms.
So why does this joint machinery actually break down? Well, it generally comes down to two main categories: biological factors and our lifestyle choices. On the biological side, age definitely plays a big role, since that cartilage naturally wears away over time, which can lead to osteoarthritis. Genetics can make you a bit more vulnerable too, and obviously a direct physical injury, like tearing a ligament or your meniscus, will trigger immediate joint issues. But here's the thing. Lifestyle is where so many of us accidentally sabotage ourselves. Carrying extra weight, for instance, puts massive unnatural pressure right on those shock absorbers. Prolonged sitting and skipping exercise totally weaken the muscles that are literally designed to support the knee. And on the flip side, overuse, like athletes pushing way too hard without a break, can absolutely destroy the joint. Honestly, an office worker sitting completely still for 10 hours a day is just as at risk as an injured athlete. Crazy, right?
Okay, so how do you know if your knee is actually in trouble? The most obvious red flag is pain when you're doing anything weight-bearing. We're talking walking or just climbing a flight of stairs. You might also wake up with this awful stiffness or see visible swelling around the joint. Then there's that restricted movement. You know, when you literally just can't straighten your leg all the way. Oh, and here's a really common, kind of creepy one. An audible popping or creaking sound when you move. Yikes. In severe cases, you might even have sheer difficulty just bending the knee at all. If you're nodding your head at any of this right now, pay really close attention to what's coming up.
Section 3. Effective home and medical solutions.
The good news is you've got a whole toolkit of options to deal with this. For immediate relief, simple home remedies like hot or cold packs work wonders. For the long haul, light stretching, yoga, and walking are fantastic for keeping that joint lubricated. Diet is a huge player here too. Loading up on fiber and calcium-rich foods, think milk, yogurt, and leafy greens, really builds up your bone density. And honestly, weight loss is probably the absolute most powerful home remedy out there because it directly lifts the heavy burden right off the joint. But what if the home stuff just isn't cutting it? That's when medical treatments step in. This starts with basic painkillers and anti-inflammatories and progresses to targeted physiotherapy to really bulk up those supporting muscles. For sharper pain, doctors might suggest injections like hyaluronic acid or steroids to calm things down. And finally, for really severe osteoarthritis, knee replacement surgery is an incredibly successful option. Look, you definitely don't have to jump straight to surgery, but you also shouldn't just cross your fingers and hold an ice pack if you're dealing with serious chronic pain.
Next up, Section 4. Simple ways to prevent knee pain.
Since preventing a fire is always better than putting one out, here are 5 super easy daily steps you can take to stop pain early. Step 1. Get into some regular, low-impact exercise. Swimming or cycling are incredible. They build muscle without aggressively pounding your joints. Step 2. Keep your weight in check. Seriously,
Every single extra pound you carry translates to multiple pounds of force slamming into your knees. Step 3. Wear proper footwear. One bad pair of shoes can throw your entire body's alignment totally out of whack. Step 4. Avoid sitting for hours on end. If you work at a desk all day, do yourself a favor. Stand up, stretch, and walk around for a bit every hour. And step 5. Eat a balanced diet so your body has the actual raw materials it needs to repair daily wear and tear. No matter how old you are, you should definitely be adopting these proactive steps.
All right, our final section, Section 5, Myths versus Real Facts.
We absolutely need to bust a few myths right now. Here's the biggest one: the idea that knee pain is exclusively caused by getting older. Honestly, how many times have you heard someone say, "Oh, my knees are killing me, I'm just getting old"? Well, fact check. Obesity, injuries, and living a highly sedentary lifestyle are massive contributing factors. Blaming it purely on the calendar is kind of just a sneaky way of ignoring the lifestyle habits we actually have the power to change.
Here's another huge misconception: thinking that once your knees start hurting, you're just stuck with that pain forever. No way! That is entirely false. With the right medical treatment, making some conscious lifestyle tweaks, and managing your weight, knee pain can absolutely be controlled, significantly reduced, and in a lot of cases, completely eliminated. You are definitely not a helpless passenger here. You are entirely in the driver's seat.
So, to sum it all up, we really need to stop making convenient excuses and start understanding the real causes. Knee pain might feel like a modern epidemic, but it's definitely not a mystery. When you combine a solid diet, targeted exercise, keeping your weight in check, and getting medical help when you need it, you can absolutely protect your mobility. So let's stop blaming just our age, toss out the convenient excuses, understand how our bodies actually work, and take control of our joint health starting today. Before we wrap up, I want to leave you with this. What is one tiny, simple lifestyle change you can make today to protect your knees for tomorrow? Seriously, think about it. If you found this explainer helpful, please hit that subscribe button, leave a like, and share it with someone who might need to hear this. Stay healthy, keep moving,